Dr. Anurag Saxena, Head of Department of Neurosurgery at Manipal Hospitals, Dwarka, New Delhi. In this video, we are going to talk to you about the treatment options available for somebody who has been diagnosed with brain tumor. Now, as commonly thought, surgery is not the only option of the brain tumor, although it is the mainstay of the treatment of brain tumors. Now, brain tumor treatment largely depends on two important factors. What is the type of your tumor, that is whether it is a benign tumor or a malignant tumor, and what is the location of the tumor. Another important factor which comes into play is the size. What is the size of the tumor and what problems it is causing you. So benign tumors, obviously the first line is surgery, and in malignant tumors also it is the first line is surgery, but it depends on how much tumor we can take out. If we are able to take out benign tumor completely, then the chances of cure rate is very high. In a good excision in a malignant brain tumor, the chances of survival becomes much more with subsequent radio and chemotherapy. But it is not true in all cases. Certain benign tumors which are small and are very slow growing, you can just follow them with serial MRIs, and they need treatment only if they become large and they start causing you problem. So certain tumors can be followed throughout the life if they do not grow with serial MRIs. Also, there are certain tumors which are smaller in size, they are non-accessible in the location, can be treated with something called as a stereotactic radiosurgery, which actually is a type of radiotherapy which is given in a single session, and it sometimes melts or controls the tumor and that doesn't grow, and that's why it is called as stereotactic radiosurgery. Now, there are tumors where surgery becomes difficult, or surgery is bound to produce an abnormal side effect or a risk. In those kind of tumors, we can directly refer them to radiotherapy or chemotherapy. Now, we have a newer modality. Sometimes the tumors are located deep inside the brain and patients are not good surgical candidates, but we need to know what kind of tumor it is to take the treatment forward. In those cases, we do something called as a stereotactic brain biopsy, which means we have a neuronavigation system or a stereotactic frame where a needle is with a small hole inside the skull. The needle is introduced into the tumor exactly where we want it to. It's just like a GPS guidance, and we take the tissue out and we send it for histopathology and biopsy. Depending on the histopathology and the biopsy, further treatment is decided. This is true for certain tumors which are called as lymphomas, and the tumors which are non-accessible, or they are going to produce a lot of side effects when surgery is contemplated in this kind of tumors. Now, depending on the surgery and histopathology of the tumor, the second stage of any brain tumor treatment is whether they require radiotherapy and chemotherapy. In benign tumors, very rarely it is required, but in malignant tumors, the next course of action is radiotherapy. Radiotherapy is usually given in settings at a certain interval of time. The single dose of the radiotherapy is divided into multiple small doses to reduce the side effect, and that is what is called as a radiotherapy cycle. Certain tumors, if they are responding to chemotherapy, and chemotherapy is usually started, it can be in form of tablets and sometimes in form of injections. So the overall outlook depends on how the patient responds to the tumor and what is the type of the tumor which the patient has. I hope this video was helpful.